how is it displayed in children? And I think being adults, responsible adults, we can actually look out for these things if the children or child isn't able to vocalize it, which is often the case. I remember my daughter used to have very bad anxiety when she used to go to a particular classes centre. She didn't like it. And the way she would describe her anxiety was, Mummy, my tummy's really, really sad. And I say, Bunny, what do you mean sad? Well, I don't, what? Sad in what way? And that was her describing her anxiety. And she said, my tummy's really not happy today. It's really sad. It's really sad, Mummy. And then she'd start crying. And I knew it was that feeling of, it was the anxiety. It was the anxiety. So let's think about some of the thoughts. Now, this can be a difficult one again, because children aren't expressive. But you might be lucky, you might be working with young people, or you might have a child in the house or outside or wherever you are that is able to tell you, because they might trust you. So yeah, they might be worried that they're going to say something silly and embarrass themselves. So it's easier to keep quiet, as mentioned with the mutism. Isn't it better and safer to just stay quiet? If you've learned in the home environment that keeping quiet keeps you safe, then you're going to be using that outside of that environment. But also there's that fear of embarrassment, as mentioned earlier. What if I embarrass myself? And for young children and even adults, it's really important for us to be part of social groups. It's part of our development. We need to be around those environments. So if I embarrass myself, I'm not going to make friends. People won't want to talk to me. They're going to know me as the weirdo who embarrassed herself. And that's going to make life a lot harder. Let's go into the emotions. And that's what I've just touched on, the fear of rejection. Of course, we all want to be part of something. Again, making a fool of yourself or making a mistake. I mean, I'm an adult. I was a bit anxious before I came on today, but I thought, but I'm human. I've accepted, I can make a fool of myself. I might say something silly. It's being recorded, but you know what? It's fine. I'm an adult. I can handle that. But there can be a lot of children that can't, and they're not able to express how they're feeling emotionally. A lot of the time, they don't even understand what the emotions are. Exactly with what I've said in regards to my daughter. Sorry, I've just got someone put something in the chat. So sorry, I've got to dip out early. Oh, sorry, sorry, Katie. No problem at all. And yeah, I hope you watch the rest of the recording a bit later. Right, so sorry guys, going to carry on now. Now, the thing with children is, this is what I think as a CBT therapist. I often get clients coming to me and they might be avoidant. So they might not actually tell me what their thoughts are and their emotions are. And that can make my job quite challenging. So what do? I ask them to describe their physical symptoms, and I ask them to describe, I watch the behaviours. Now, you can do this with children. So let's say, for example, they're not sharing their thoughts, their emotions with you. It's really important as adults that we are able to look at their behaviours. Sometimes it's very difficult to pinpoint. Like, you can see a child having a tantrum, and it's happened to me before, where I've gone to a shopping centre and my daughter has deliberately fallen on the floor and decided to cry, and it's been embarrassing. But at the time, I thought, gosh, she's just being naughty. But actually, she had anxiety, and it was social anxiety because we were in a very busy environment, and it took me years to figure that out. So yeah, watch out for the tantrums and the crying. If they become upset over certain situations, just as I explained, my daughter going to this specific place, she used to get quite anxious and say, my tummy hurts as soon as she had to go there. Physical symptoms are a good one. So if you notice children shaking, finding it quite difficult to breathe because they're nervous, shortness of breath, yeah. Some children will sweat, some will fidget, bite their nails, peel their skin. Eye contact is a good one. They might avoid the eye contact. Again, you might not find all of these in every child. You might find this only in some children. Okay. So, as mentioned, discomfort will be experienced as fear and anxiety, and yeah, there's a little definition at the bottom of what to experience when people have anxiety. Right, so I'm just going to go to the next page now, guys. There's quite a lot there, so I'll try and keep it brief because of time. So what does social anxiety, how does it manifest in different settings? And I've got things like schools, playgrounds, family gatherings. Now, students with social anxiety, they may feel conscious and anxious. Social performance can be a factor, as mentioned, for example, presentations. And this is why, a lot of my clients that have come to me, they've had a lot of difficulties early on in life where they've either belonged to families that are very quiet and they haven't been able to express themselves. So as adults, they struggled with it. It created a lot of anxiety. It wasn't something they were exposed to or something they did. Sorry, guys, I've just got another message. Oh, yeah. So the question by Megan is, would you say that a toddler that gets upset about the prospect of going to nursery, gets very upset, reluctant to go, cries on the way, etc., doesn't want to see other children is an example? Right, yes, I'm glad you said that, Megan, because working as a SEN officer, it can be quite difficult to really know if it is social anxiety. Now, I know I've worked with children that have also had autistic traits. I'm not saying it's that, but I'm just sort of saying it could be other neurodiversities. But yeah, from what you're saying, if the child is absolutely fine at home and you haven't noticed anything, and it is really about getting your child to nursery that's creating that, yeah, it could be that. It could be the fact that your child doesn't want to go without you. It could be attachment issues where they want to stay at home with you because they love you. It's that fear of you maybe not coming back, which can often be something that is found with young children. But and he always seems happy when he's there and he comes home. Oh, yeah, my daughter used to do that. So she used to cry all the way there, and then when she got there, she was happy as Larry, and you thought nothing had happened to her. And before I got her there, it was like she was being abused. So no, absolutely, it does sound like it is anxiety, absolutely. But again, with that sort of situation, it's really important that you continue the routine going, because once the children figure out that they can stay at home, yeah, they will take advantage of that, and then they'll know you're a bit of a soft touch, and then you stay at home. So it's good that you're doing that, because one form of therapy is exposure, and you're exposing your child to that situation to teach them that nothing bad is going to happen, because anxiety often makes us think something bad is going to happen, or something terrible is about to happen. So I would just say be patient with that, keep going. And this is actually, I'm going to go on to this, so this might be helpful for you, Megan. So I'm going to keep going. Oh, no problem, Jess. Enjoy the video later on. That's fine. And nice to meet you. So, guys, I'm just going to close the chat for a minute and go back. So, yeah, speaking from class, raising the hand to answer a question. Eating in the presence of peers. Eating could be an issue. Not wanting to eat in case they don't eat properly, or they embarrass themselves, or they drop the food. That type of thing. That's something to look out for as well. Now, the thing with this is lonely and withdrawn. If you're dealing with a child with maybe autism, they're quite happy to be on their own. And I used to always say this when I used to go into the schools. I used to get teachers saying, and even parents say, but my child doesn't want to play with anyone. And I said, but they seem quite happy not playing with anybody. If the child is saying that I'm lonely and I've got no friends, and they're complaining about it, then okay, possibly social anxiety. But a lot of the children with neurodiversity, they were quite happy playing on their own. So that's something to also consider. I know it sounds terrible because you don't want any child to be on their own, but if a child is happy and that's what they're content with, you have to accept that. That's just who they are. Physical symptoms, yet again, I think we've touched on that. Racing heart, panic attack could be. When they face feared situations, they may be targeted by bullies. That's another thing. If they've got another child there who might be a bit aggressive, and that could be something. I think one of the other, was it yourself? Was it Megan? Someone did ask about a child. Let me just get the name right. Sorry, Megan, that's right. It might be that sort of situation as well. Maybe they haven't got friends, or maybe there's a child that might be making them feel a bit unsettled. But it's worth having the conversation just to find out. Yeah, school counsellors, which aren't always in place these days, and what's the last one? Yeah, but overprotected by well-meaning friends who are willing to talk for them. Yeah, so sometimes schools are able to put in a budding system where they have someone go in with them to the playground or within a setting, and all of these things can be put into place if the school are willing to support you, if they notice that is, and that's not always the case.